Hi, I'm Dr. Frezza with Alternative Health Empowerment, also known as Alternative Health and Beauty. In here I'm going to be showing you a little bit about our Hydrocolon Therapy room and the device that we use. It's called the LIBBE system. It's the lower bowel evacuation device. Now there are two different types of systems that you can use. One's called a closed system and the other one an open system. This is considered to be an open system. The difference between the two is that a closed system requires a hydrocolon therapist to be in the room with you. They actually do the insertion and do colon manipulation to help break up the material inside. I find that most people that would be willing to do hydrocolon therapy really don't want someone in the room with them, which is what led me to find this device and purchase it for use here in our facility. I actually have two of them, so if people come two at a time, we can do both. What this system does is the individual comes in and I teach them how to use the device. It takes about 10 to 15 minutes to go through the entire process, teach you how to manipulate the colon, break up the material, and then I exit the room. The person will then disrobe from the waist down, get on the device, do their own insertion, and then cover themselves with a sheet. In this device, and the way we do it here at this facility, is your dignity is preserved at all times. No one ever sees you disrobed and you do your own insertion. So let me explain a little bit about the device and how it works. Water comes in, and it's normally water purified through the city by its regular standards, MLGNW. From there, it goes through a little silver tube that we have down in the back of the cabinet that has an ultraviolet light in there. What happens there is the water passes through that ultraviolet light. The ultraviolet light will kill any living organisms inside of the water, any bacteria, virus, microbes of that nature. From there, it goes through this filter here, which is about a 0.5 carbon filter, 0.5 micron carbon filter, and that removes any of the other impurities in the water, including up to about 98 to 99% of the fluoride and chlorine that's in there, which we all know is toxic chemicals also. From there, it goes into this tank here, which is the holding tank, and that is where this top number here shows you the temperature of the water. Now the temperature that we shoot for is between 97 and 101. If you go below 97, it can make the body feel chilled. If you go above 101, it can make you feel like you've got a temperature, and you might get a little nauseous. So we recommend those two temperature ranges. The number you see below it is 104. That is a safety device that allows the temperature to go up to 104, but as soon as it exceeds it, it'll cut itself off, preventing you from being burned. At that time, you'll get one more gravity feed tube of water, and then no more water flow until the temperatures are adjusted. So I teach you how to use the device, how to make those rapid changes. If there is any difficulty at all, we do have a wireless doorbell ringer in here. All you have to do is ring the doorbell, and then I come in and take care of any issues that you may have. Now, as far as the flow of the water is concerned, there's a pump underneath, pumps it from this tank into the gravity feed tube. The most you're going to get is between 2.5 and 3.5 psi. Now, a colonoscopy, they blow up your colon with between 70 and 140 psi. That's a lot. Just blow you up like a little balloon. This is very, very gentle. It is body temperature, basically water. Very gentle infusion of ultra-purified water. There's a little cramping associated, just like it would be with an enema. Right? But we also heat up a heating pad, bring it in and place it on the abdomen, and that kind of eases some of the cramping associated with that. Then, as you're on this device, and the bottom bowel is cleansed out, that's when the manipulation comes in. What you'll do is you'll follow your colon up. The anus goes straight up about 7 inches, bends to the left side of the body, which is the sigmoid colon. Then it goes up in the descending colon, across transverse, and then over to the ascending colon, all the way down to the cecum on the right side of the body. What you'll do is you follow that water around and help fill it in, going in a counterclockwise motion. And then manipulate that colon, massage it, and break it up. On the back side of the device, there's a mirror mounted on the wall and a clear 2.5-inch tube so that you can actually see the material as it comes out of the body. So, as that goes through, and if you're tired of seeing the material that's there or you want to see what comes out next, you've got a flusher jet where you can turn it on and blow the material by and then see what comes out of the body next. We've actually had people pass coins and toys that they swallowed back when they were just little children. There's a 54-year-old lady, when she was 7, had a barium enema. And at 54 years of age, when she had a hydrocolon therapy session, there was a pocket of barium inside that colon encapsulated in dry, hard fecal material that let loose and came out. Had been in her colon for 47 years. So there's a lot of material that can be stored inside the colon. A regular person of average weight can carry between 5 and 20 pounds of dried, hard, compacted fecal material inside the colon. I've had one gentleman here after 2 sessions say that he lost 15 pounds. So you can imagine there's a lot of material that can build up inside of that colon. Also, anything that does not come out of the colon within about a 12 to 14 hour period, you begin to reabsorb those toxins back into the blood system. From the colon, the blood supply goes directly up to the liver, which is the hepatic portal, from there to the lungs for oxygenation, then directly to the heart for redistribution. So it's got a very short period of time to clear those toxins out of the body before it gets distributed right back through the entire body. So you can see that it's very, very important to keep your colon health at optimal. All right, now, as far as comfort is concerned, you've got a nice cushion table or back here, pillow for comfort. We turn the lights down. We have gentle music playing in the background and some candlelight, nice smelling candles burning in here. And there is a plumbing stack back here in the corner that actually has a fan on top of it. Creates a suction in the device, and any odor is then taken up through the ceiling, out through the roof, and distributed outside so that there's no odor in the room either. I do not check on you. I didn't appreciate it when people poke their head in on me, so I leave you entirely alone. You do have the doorbell. If you have any problems, any questions, any issues, ring the doorbell and I'm at your beck and call.